Hi, advanced class. I'm going to demonstrate how to insert a multi-lumen airway today. And I'm sitting down, so I'm not quite in optimal position, but it's the way the video had to work. So I'm going to use a Combitube today, and there's two sizes of Combitubes. There's a small adult and a large adult. Small adult is, 5 feet to almost 6 feet, and large adult will be 6 feet and over. So on this guy, we're going to use a small adult size. So I've gathered my equipment, I've got my BSI on. I'm going to ensure that my patient is hyperoxygenated, so I'm going to insert an oropharyngeal airway. This is hooked to 100% oxygen at 15 liters, and then we're going to bag valve mask him, making sure he's hyperoxygenated. So I'm going to have a partner. David's going to help me hyperoxygenate this patient while I check my equipment. So you're going to lose our heads now. So I'm checking my equipment. I've got my tube. I've got 2 syringes. I've got my suction and my vomit director device. So I'm going to check my equipment while he's hyperoxygenating. My first pilot balloon, I'm going to check this, and it's nice to leave it in the package while you're doing this, so you keep it sterile, so it doesn't feel like it's got a leak in it. So I'm going to deflate the air. And then my second balloon, I put about 15 mils of air in. And my esophageal tube looks great. Alright, so I've checked my equipment. We can lube with a water-soluble lube, keeping care not to get it right on the holes. So, do you think that he's hyperoxygenated, David?
Yep.
Okay. Go ahead and pull off. We're going to take the OPA out. We're going to put him in sniffing position. I'm going to do a tongue jaw lift and insert mid-line until the teeth are right at the teeth marks there. Get ready to ventilate for me. Alright, so David's going to ventilate. I've put 100 mils of air in a 15 mils, and now we're going to listen to his gut sounds. And I'm going to listen to the right lung. And I'm going to listen to the left lung. And if I have air movement in the right and left lung, we're good, and we're going to stay with our tube number 1. If I do not, if I have no breath sounds, we're going to go ahead and go to tube 2, and I'll do the same thing, and I'll listen to the lung, or the gut, and the right lung and the left lung. So we'll say that this one is on the number 1 spot. So I verified. Go ahead and ventilate him about 5 to 6 times a minute. I'm going to secure this device with a Thomas tube holder here. I'm going to go ahead and secure it to his face first, and then secure the tube. So we're going to have our SpO2, our end tidal. If we don't have an end tidal monitor, then we're going to use a colorimetric device. Remember that our colorimetric device is yellow is yes, it's sensing higher concentrations of CO2. Purple is poor, lower concentrations of CO2, and then tan is think about it. Think about what might be going on with your patient if something is wrong. So we're going to use this device. I'll go ahead and take that off, and we're going to look at the color change after about the 6th or so ventilation, and it should be yellow. This isn't going to change. If I was intubated especially, and it hasn't really been shown to be effective in supraglottic airways or multi-lumen airways, but I can use an esophageal detector device, deflate, put it on the end of the tube. If it stays suctioned down, that means that it is in the esophagus, and my endotracheal tube is in the esophagus. If it inflates, that means it's in the trachea with the tracheal rings not being able to collapse around it. So I'm going to continue to confirm placement, checking my SpO2 readings, my end tidal readings, seeing if I have misting in the tubes, making sure that he stays nice and hyperoxygenated, and hopefully he won't regain consciousness on us. If I was being nice, I would put my little gastric emptying redirector device on, so in case he does vomit out this tube, it will go in a different direction as me and my partner. We can suction through the esophageal tube and hopefully help that that gastric inflation. So I have secured it. I'm going to continually monitor my patient for any signs of problems. So there you go. All right, to DC this, if he starts to regain consciousness, we're going to hyperoxygenate the patient. We're going to have our suction on. We're going to go ahead and tell him to relax a second. We'll get this tube out. We'll take the securing device off. We've got to deflate our cuffs real quickly. We'll turn them on the side. Have our suction ready, turn them on the side, deflate the cuffs. Cuffs are deflated, and suction and go. And then we'll suction, and he's gonna not feel so good for a minute. Once he's done, we're done. All right, thanks, David. Such a good help.